Good afternoon. My name is Chaturaka and I am from Sri Lanka. So, how many of you have heard of Sri Lanka? Yes, it's much better than I expected. Sri Lanka is a small country beneath the Indian subcontinent, and it's interesting to be in Netherlands because Sri Lanka was also a Dutch colony about 4 to 5 centuries ago. And just to give a brief introduction about Sri Lanka is a unique country in Asia that because it has one of the lowest maternal mortality rates, neonatal death rates, and highest life expectancy for men and women, and highest very high literacy rates, because successful governments and professionals in Sri Lanka have put their priorities right and they invested in health. And it almost parallels that of Japan, the statistics, because that's one of the most developed countries in Asia, and Sri Lanka is almost, despite being a poor country and a resource limited setting, it has concentrated on its health. And to tell about me, I'm what you would call a junior doctor. I'm a registrar in medicine, that means I'm in the postgraduate training program. And I'm also a lecturer in medicine in the Faculty of Medicine, University of Colombo, Sri Lanka. And today we are going to talk about doing research and audits in resource limited settings. And this is what we are going to briefly discuss about. And we are going to, this is not a textbook lecture, this is something that is close to my heart, that I will tell you what I have done, my experiences, and how you can adapt my experiences to your own setting and do something productive. So this is how the talk is going to be structured. We are going to talk about why should we do research, and then we are going to talk about the concept, are there actually any resource limited settings? And then this whole talk is centered on two concepts, the obstacles and the resources, and how you harness your resources to overcome your obstacles. And then we will go on to discuss planning your research and doing it, getting your hands dirty, and few tips on publishing, how to get this thing published. I mean, obviously you are doing research under strange circumstances, no money, no limited sample sizes, and inability to do complex procedures, but how to plan something that is publishable. And then I will tell you about a few of my personal experiences, and then we'll have an interactive session, and then we'll discuss a new concept that I have come up with, which I like to call it collaboration of colleagues, and I would like your feedback on it. So why should we do research? And I'm sure if you go through a textbook, you can find 1001 reasons as to why we should do research. What I would like to say is it's passion. It's about doing something new, finding something out new, or finding something out that was not so obvious. So you get an adrenaline rush. So you do it more and more and more, and to find new things. So it's a passion. And it's a way out of monotonous boredom of work. I mean, we take pride in being doctors, saying that our work is not monotonous. Because we meet individuals every day, and new individuals every day, and we solve new problems. But as years go by, then you meet with the same themes. And at the end of the day, it is anyway monotonous. So this is a way out of the monotonous boredom of work. And rather than being an appendage of the system, you get to be an important part of the system that can change something. So you leave, when you retire or when you go off, you leave your mark behind rather than being just a worker who just worked there. And the last reason is obviously very important. It's very important for personal development. Being a researcher, and if you have your publications, that shows you are an innovative thinker, you are able to take up a challenge, and you are able to work on something. And that is something employers would love to look in a CV. So that is extremely important that you do research for your personal development. It will open up a lot of new avenues and new opportunities for you in life. So then, let's talk about this basic concept. Are there any resource limited settings? So my answer to that is no. Because resources does not equate with money, the finances you have. There are multiple sources of resources if you are just willing to look around. Every setting is full of resources. But then I would go on to say, not that every setting is deficient of resources, not that every setting does not have resources, but not every setting is also full of resources. It does not have all the resources. Say you are going to do something on tuberculosis. And in UK, you may have all the money that you need to do advanced diagnostics and everything, but you may not have patients. So in Sri Lanka, you have plenty of patients, but you may not have the money to do all the advanced stuff that you want to do, molecular genetics and stuff. So not every setting is full of resources, but not every setting is deficient of resources. So here are some examples of abundant resources. Patients, that depends on what you're going to study, of course. And colleagues, which can give you valuable ideas. Records of hospital records. I mean, surely any hospital must keep records. And your brain, the most important resource. Then about the obstacles. The biggest obstacle you would have to doing something productive is your own inertia. I mean, you might have an idea, but you don't go beyond that. I mean, you don't go on to develop that. I mean, ideas just come off like lightning bolts and then they just go off. What you need to do is you need to catch that lightning bolt and develop it, and make fire from it. And then there are issues like, do you know how to do it? Do you know the methodology? Are you familiar with the methodology? Are you familiar with the statistics that you are going to need to analyze your data? And then, of course, you have your bureaucracy and legal issues, getting ethical clearance, and all those things matter. But sometimes they are sort of like you have to go out of the way to get things done, and that's really depressing. And then about funding. So I'm going to talk from my personal experiences, and none of my studies needed funding. I mean, they needed a small amount of money, but that is something bearable out of the pocket. And they all got published. So, I mean, like, what you need to do is that you need to adapt your ideas to the setting that you are working on. And I'm going to give you some personal experiences and examples. So we'll come back to that later. So then you have your resources, you have your obstacles. I just outlined a few of them. So what you need to do is, it's a very simple concept. You use your resources to overcome your obstacles. First of all, the most important obstacle, I said, is your inertia. You have an idea, but you don't want to go beyond that. So make up your mind to do it. That's the most important thing. And then you should identify the specific barriers that you might encounter when you are going through this process of doing your research. And then you must find out the resources that you have to either circumvent or to remove the obstacles. So for example, you might have to change the study design. Rather than doing something prospective, you might have to go back in time and do it retrospectively, because the patient numbers are limited and you don't have time. And if you don't have adequate knowledge, then improve your knowledge. I mean, knowledge is now in abundance at the click of a button. There's internet, and then, there are huge databases available. Improving your knowledge is much easier now than it was 1 decade ago. And this is the most important concept, starting small. You don't have to do something big to show results. Start small, and if you start small and finish something, that will give you an adrenaline rush to go on to do bigger things. So, and if you start something big and don't finish it in the first place, then that will be a flop from the beginning. So that's a very important concept, starting small. Then when you plan your stuff, identify a quick question. And you have to be extremely specific about what you are going to observe. While you identify a quick question, make sure that you are flexible about it, because you may not have all the resources that you would need to do it the way you want to do it. You may not have all the funding, you may not have the legal clearance, and you may not have enough patience. So be flexible about the question, about what you are going to look at, and have several ways to solve the problem. Ideal way, in ideal setting, may not always be the practical way. Because say that you want to assess the outcome of patients with PTCA, percutaneous coronary intervention, in Sri Lanka. You can't do it, obviously, because we don't have free access to it. because it's a very costly procedure, and in our setting, I mean, it's a developing country, and patients have to bear some of the cost that is involved in stenting, so which a lot of people cannot do. So not everybody can afford that facility, even in acute care. So they are mostly managed medically. So if you want to assess the outcome of patients with PTCA, you can't do it. But then, what are the alternatives? We'll see. And then you must do an extensive literature review. You must see what is published and what is not. And this is an extremely important part, because you see you have your own obstacles, but going through the literature review, you can find out how other people have done it, and what are the obstacles they have faced, and how they have adjusted their study so that these obstacles were overcome. And there's another important thing in identifying this, in going through the literature review, because you get to identify the target journals and the audience. And if you find a study that is comparable to your study, and if you go through the bibliography, you might find the journals that might publish your work also, because that's their interest. And then, once you identify a key question, and once you do extensive literature review, you must plan what you are going to do. Are you going to do it prospectively or retrospectively? That depends on the resources you have. Prospectively, if you have enough patience and if you have enough time, it might be better. But some diseases are rare, and you might not have enough samples, good enough sample size. So then you need to go back in time and analyze the records, maybe. Do you have enough time? And do you have enough funds? And what about the sample size? And this last thing is extremely important. Are you collecting too much or too little data? Because, there's no point of going haphazardly collecting data if you're not going to analyze them at the end. So it's better if you talk to a statistician first and before starting it, than going back and seeing that, I have collected too much data and I don't know how to analyze it. So it's extremely important that you are specific about what you're going to observe, and then at the end of the day, analyze. And if you collect the exact amount of data, you will save a lot of time, which can be used to increase your sample size. So this is basically what I told before. You be specific about what you're going to observe, and how the analysis should be, and who is going to do the analysis first of all. That's very important. Speak to a statistician first. And what to do if there are non-significant results. And that also you must think beforehand. And at this stage, you must be prepared to make drastic changes, because everything is still in your mind. You have not actually gone and done anything. So it's still in your mind. So you still can make drastic changes if you need it. And then this is a very important concept. When you're doing it, you must do it yourself. You can't have other people to do your work, and you must collect your own data, because you have ownership in your research. And if anybody else is going to collect data, then they might also have to be authors on that. So, then that is the only way that somebody is going to own a project and put 100% into it and then do it. And then, it doesn't matter what you do unless you get it out there. You must publish your findings. And that's what I said. It's very important that you identify several target journals at the very beginning. You must have at least 10 backups. If one rejects it, where to send it next. And writing matters as much as the findings, because you may be familiar with what you do and you are familiar with your work. But when the manuscript goes to an editor, it's a completely new idea to him. And he must be able to go through it clearly and pick out the salient points and see whether it's worth publishing. So writing matters as much as doing it. So that is extremely important. So when you're writing it, please be precise and concise. Length doesn't mean anything. It's the content that matters. And every small detail must be paid attention to. And of course, you don't want to irritate the editors. Now these days is online submission. So basically, you have to format it to the journal style, and you at least I mean, if you take 6 months or 8 months to do a study, or more than that, probably 2 or 3 years, and I mean, like, to read it about 50 times, it won't take about 3 weeks. So it matters. Each time you read it, you find something new, something that can be improved. And of course, you must be very flexible when responding to peer review. So we have discussed some basic concepts. To go back, I would like to recapitulate some points. First of all, the question was, are there resource limited settings? And I said no setting is full of resources, and no setting is deficient of resources. And you have to adjust your idea according to the resources you have. And then we came to discuss about the issues of obstacles and resources, and how to harness your resources to overcome your obstacles. And then I gave you some practical tips on planning your research and actually doing it, and writing it in a form that can be published. And then now I would like to go back on some of my personal experiences, and to share with you the kind of obstacles that I have seen, and the kind of resources that I have harnessed to overcome these obstacles, and see that if any of these can be adapted at your setting. So let's see. When I was a house officer in the university medical unit, that means I was doing my internship. So we want to do something on patients with ischemic heart disease. So like I said, now we have many obstacles. Funding. Now you cannot assess the outcome of patients with PTCA or some advanced procedure in there, because not everybody has access to it. And you can't have a sample that would be adequate. And limited time. I didn't have a lot of time to finish my study. So then I also looked at the resources that we have. It's a tertiary care referral center, and daily we get a lot of referrals, and there are lots of patients coming in daily with acute coronary syndrome. And I had good supervisors. So that, of course, is a lot of ideas come from your colleagues, and you can learn from them. So those are all resources. So what's the way around? So first of all, I started small. That's a very important concept. If you start something small and finish it, then you get an adrenaline rush to go and do bigger things. And rather than concentrating on very complex procedures, what we decided to do was to look at the ward management and how we handle patients with ischemic heart disease in the ward. I mean, it matters because this is supposed to be one of the best centers in the country that is available, and how we handle patients with coronary care syndrome is a reflection, at least in theory, of the kind of care that is available to an average patient in Sri Lanka. So on that concept, what we did was we assessed the adherence to guidelines in management of patients with acute coronary syndrome in our unit. And it was published, and we finished this study, and it was published in the Journal of Clinical Pharmacy and Therapeutics. So it matters that even if it's small, and if you do it correctly, it is publishable. And it helps to improve the system. And we found a lot of flaws, and we put our hearts and mind to improve that. And then we want to do a study on transplant patients. That is again when I was a house officer there. Transplants, meaning by transplants, I mean kidney transplants. University Medical Unit Colombo is the first unit that pioneered kidney transplants in Sri Lanka way back in 1985. So now we have a unique cohort of patients who have been, hundreds of patients who have been transplanted over the years, who have all the complications of all the spectrum of complications of transplants, successes, failures, and everything we see. So it's a very valuable cohort of patients if you want to study, and that is a resource. And all these patients have neatly kept records, and there's another resource that you can use. And of course, then there's the obstacles. Not all of them come for follow-up, and we lose track of them. There's attrition. And of course, time is limited, and things have to be finished within a short period of time. Because I was doing it, and when I finished my training, I would go out of the unit, obviously. So the way around, what we did was, if patients are not coming for follow-up, we contacted them over the phone. And there were several follow-up clinics, so I personally went to each and every clinic. And records are very important because they carry well-maintained records. So we went through everything and we collected the data we want. And when we are looking at the transplant cohort, we can concentrate, we can look at various things. Rather than doing something haphazardly, what I did was, I looked at something specific. So, as much as you can go through a lot of things, I looked at the prevalence of post-transplant tuberculosis and cytomegalovirus infections. So that is something specific to look for, something you can address. And that was published in, this is a 2-year retrospective analysis of renal transplant patients in Sri Lanka. So this also helped to improve the system because we knew what was lacking and how we can improve. And then once I finished training as a house officer, I was posted, ministry gives you posts. So I was posted in the periphery. So periphery means and I was supposed to do psychiatry. I was medical officer in psychiatry. So that was an entirely new specialty and a new place of work. So, you have a lot of obstacles in this. There's a new specialty, a new place of work, and there's lack of academic collaboration in the periphery, and it's a whole different ball game. But then again, you have your resources. My resource was passion for research. Wherever you work, and what specialty do you do? If you want to find out something new and improve the system, you can do it. And another resource was it was a completely unstudied population. And they had their own unique set of problems, and nobody has looked into them. So the way around. The way around is building your interest in the new subject and making new collaborations, exploring new avenues, and integrating work with research, and that is extremely important. Now I'd like to give you an example, because Sri Lanka has one of the highest suicide rates in the world in the mid-1990s, especially the adolescent suicide rates. And it was next to Hungary only, as far as I can remember the statistics, in mid-90s. So the government looked into this, and they thought that the rates of anxiety and depression were high among the adolescents. And one measure of correcting that was, they thought that they should get these medical officers of mental health to go and give lectures in schools about coping skills and strategies and various other things. So this was part of my job, to go to schools and lecture them about coping skills, examination skills, and various things, on the assumption that there are significant the incidence of depression and anxiety among school children was significant. But nobody has actually studied it. Nobody has actually thought of saying that how much are depressed and how many are depressed and how severe they were depressed. So what I did was, when I went to give the lectures, I just prepared a small questionnaire, a standard questionnaire was translated into Sinhala, the native language, and I just distributed it among themselves. And they were asked to put in some basic details as whether they are male or female, what age. And then there was an open-ended question at the end, enumerate the biggest 3 problems you have at this particular time of your life. And we analyzed this, and we got some very interesting data. And it was a small study, but it was published in the Journal of Child and Adolescent Psychiatry and Mental Health. And this paper was, it attracted the attention of a lot of people. And in fact, it showed that a considerable proportion of students were depressed and anxious, especially in the examination classes. And the main reason they suggested was not drugs, not substance abuse, not relationship problems. Their main concern was the exam. Because everything in Sri Lanka depends on whether you pass your exam or not, in the general government exam, because that determines whether you may. The competition is tough to get into university, and if you don't get into good university, you don't have much choices in life. So that was really highlighted in this study. And then this is the last example that I'm going to take. That is then there was an issue of cannabis use. The area I was working had one of the highest rates of cannabis use in the country. But nobody has looked into this. So if you are looking out for things to study, you can find enough examples. So then there are the obstacles, the social issues and stigma that people don't come out and talk that I'm, and tell that I'm a cannabis user. I mean, they hide it, but obviously then we didn't have the ability to test for urine for cannabinoids in the hospital. So we cannot actually go for a prevalence study. So if you do something prospective, you would only have few patients. So what the resource I found in this case were the records. And the hospital keeps well-maintained records of all the patients who have sought treatment over the years. And when a patient first comes to the hospital, a file is opened for them, and each subsequent admission and each subsequent consultation, the same data is updated, the same file is updated over time. So when you look at a file, you have all the patient records neatly filed up over time. So if patients have reported cannabis use at any point of their consultation, I mean at any point of time since their first contact, so that would also be recorded. So what I thought of doing was a retrospective epidemiological study of assessing prevalence of cannabis use by self-report and seeing how many I mean there are a lot of issues about cannabis, and one area is that whether cannabis predisposes to the development of schizophrenia later in life. So what I did was, and this is not an established entity yet, so what I did was I went through the files starting from 2000-2004 and picked out the ones who had reported cannabis use at any time of their life, and then went through the files again over time to see how many of them were diagnosed with schizophrenia later in life. And this is open access. It was published in Substance Abuse Treatment, Prevention and Policy. And it's a retrospective analysis of cannabis use in a cohort of mentally ill patients in Sri Lanka and its implications on policy development. So you can access this if you're interested. It's access to PubMed and the journal website. So in summary, what I would like to say is that there are two core concepts here. You have the obstacles to do research and you have your resources. Obstacles would be the inertia, funding, legal issues, bureaucracy, and time. But don't forget the resources also that you have. Your brain is the most valuable resource you have. And the passion that you have for research, to find out something new and to improve the system. And then collaboration, innovation requires patience, and if you look around you can find 1001 resources. The thing is that you need to design your study in a way that can be carried out in your setting. And there's another concept that I would like to introduce, desk research. Now, when you have a research question, like many of us would when you have a question in clinical practice, many of us would go and read a book, and if you are really interested, you would go and read 2 or 3 books and say this is what this book says, and this is what that book says, and this is what I'm going to do. But what I would do is I would go one step further, and I would use a database to substantially analyze all the published data or research or articles that are available in that particular topic, and to gather each and every point of all those publications, tabulate and code them in a way that is relevant to my question, and then come up with, critically analyze what is said and what has been found and what is not known, and then come up with an own concept paper after critically analyzing them of what I think of the problem, which is quite relevant you can just go and read 1 or 2 articles and books, or 1 or 2 books, and say this is what has been said and this is what I should do. But if you look at the broader picture, and if you see if you try to collect all the data that is available and then critically analyze them, the picture that you get is quite different. That is what I would call desk research. You identify a key research question, you collaborate with experts and expand your idea, and you do an extensive literature review, you critically analyze the data, and you come up with a summarization or your own ideas about how to approach the problem. So I'd like to give you some examples of some of the things that we have done over the past few years. developing a clinically relevant classification to predict mortality in leptospirosis, atypical manifestations of chikungunya infection, that is something that we have looked at is, and then we have looked at the social issues, few social issues, HIV, poverty and women, hidden burden of malaria, cognitive impairment following infection. So, I mean, if you look around, you can find, I mean, enough questions which you would go on to develop and do something and find out the answers to your questions. Whether, I mean, like, you must not go by what other people have said, and if you don't believe that something is not, if you believe that something is not right, plan your research and do it properly, and then try to find out the answers to your questions. But the thing is, many of you have bright ideas, but you might not want to go beyond that. I mean, like, time passes and people can't overcome their inertia, and that's the biggest issue. So the interactive session, what I would like to do is think alone and try to write down ideas for a project. I mean, think of your own setting and how the position that you are working in, and the kind of resources you have, the kind of obstacles you may encounter, and write down the ideas for a project. Identify your resources and identify your obstacles. And let's share your ideas and ask for solutions from the rest of us. Because if any of you have a question, then I'm sure one in the audience might have the answer. Anyway, sorry, what's your name, if I may ask?
Yes, it's Kishore.
Kishore. Yes. Right, now Kishore basically had an idea for a project, and within about 5 minutes of time he has found out the resources for the project that he wants to do and the obstacles that he might encounter. And within the next 5 minutes, he got he expressed his concerns about the obstacles that he might find, and within the next 5 minutes, he got suggestions from all over the world, one from Canada, one from USA, and one from wherever. I mean, that brings on to my next concept that I'm going to talk about for the next 10 minutes. And do you have to come to the International Forum of Quality and Safety in Healthcare to get this sort of input? No, you don't. And this is an idea I just came up with. I mean, this is how ideas happen. This is an idea that I came up with while I was making the presentation. Now, there are these studies called multinational multi-center studies happening in different places around the globe. And it seems a big concept, but actually it is not that big. A collection, what about a collection of small parallel studies in different countries? Who needs funding? Because you have the biggest resource that people did not have about 10 years ago. 15 years ago. You have the biggest resource, the communication. You have your internet, you have your email, you have your Facebook, you have your Yahoo. So, I mean, what happened in the last 5 minutes in this conference room can happen 24 hours a day, 7 days a week from anywhere around the world, if you have actually thought about it. So what I propose is something like a collaboration of colleagues. Let's make a network of colleagues communicating over the internet. I mean, like, information is not freely available and communication is freely available at the click of a button. Why not make use of it? Why don't you pool the resources, collaborative research, which will enable us to have bigger and diverse cohorts? Why can't we do projects of a similar theme or the similar project, mirror projects in different countries? And that each project will not require a lot of funding. But as a whole, if you do look at different small projects in different countries, and we can communicate over the internet and email, and at the end of the day, it will be a multi-center, multinational study, where you find out different resources and different obstacles that may be relevant in each setting, and you can learn from the settings, other settings that might have looked at the same problem. So, I mean, like, so this is an idea that can actually happen if you're really interested. So basically what I want to, at the end of the lecture, what I would like to say is that research is a passion, and you just need to get into the groove. And once you do it, once you do one or two, you'll really find out how you can improve the system, and you will get interested, and as a whole, the system will benefit. And if you're interested in my idea, then these are my contact details. So you can at any time email or call, and I mean, like, this may be one way of legalizing Facebook access in hospitals where you work. Because like social networking cannot, I mean, like, people always view the workplace, bosses always view social networking in a negative mode these days, but rather than cracking jokes and, like, you know, while chatting with all these redundant issues, I mean, you can also use the social networking to improve the system. I mean, like, it doesn't matter whether you communicate formally or not so formally, as long as you get the ideas across and make a hub and get things done. So thank you.